A very good morning, all my dear friends. I am Dr. Baldawa, speaking from SS Baldawa Neurosciences and Women's Care Hospital, Solapur. Today, I would give a brief update on what is polycystic ovaries, polycystic ovarian syndrome, and how do we deal with it. In my day-to-day practice, I am finding that there is an increase in the rate of PCOS that we are seeing every day. The reason could be a change in the lifestyle, increase in obesity, delayed marriages, and the stress that we are going through. What is PCOS? PCOS, the name stands for Polycystic Ovarian Syndrome. It is a disease, or you can say it is a malformation in which the woman has either hyperandrogenism, anovulatory cycles, and irregular menstruation. According to the Rotterdam criteria, a presence of any of the two will classify a patient into a case of PCOS. The reason for this is increase in the obesity that is we are finding in the adolescent age group. In my OPD nowadays, I find that more and more girls and more women are obese and having a BMI of more than 30. This could be because of the lifestyle that we are living today, increase in the eating of junk food like burgers or McDonald's, or increase in the intake of rice and invisible fats that is causing an increase in the obesity. In PCOS, the main problem is insulin resistance. Insulin resistance causes increase in weight gain, and to deal with it, we have many oral drugs like metformin, myo-inositol, D-chiro-inositol, chromium, folic acid, and bromium, lycopene. All this in proper combination, a combination of myo-inositol and D-chiro-inositol in a ratio of 40:1. All this can be given in the drug form, oral formulation, to correct the hormonal imbalance and the insulin resistance that is seen in PCOS. Also, a diet modification and lifestyle modification is something which is required to treat PCOS. Diet modification mainly to cut down on oily stuff, junk food, rice, and things which increase our weight. Also, lifestyle modification in the form of regular exercise, brisk walking which causes sweating and burns the calories. This is something which will help in weight reduction. Along with this, if the patient is not responding, then we switch over to oral medication or to injectable drugs. The oral medication that we usually start with is clomiphene citrate or letrozole. Clomiphene citrate is usually given in the dose of 50 mg and increased up to 100 or 150 mg in respective cycles. If the patient does not respond to clomiphene citrate, that is, she does not ovulate, or there is no pregnancy after 6 months, then it is called as clomiphene resistance, or it is called as clomiphene failure. If she has not ovulated with clomiphene in 6 to 8 cycles, then she is a clomiphene resistant patient. But if she has not achieved pregnancy but has ovulated, then it is called as clomiphene citrate failure. Nowadays, we have a better option than clomiphene, that is letrozole, and letrozole can be given in the doses of 2.5 mg per day or in a higher doses of 5 mg per day for 5 days, or even up to an extended regimen of up to 10 days to bring about ovulation. Letrozole causes monofollicular development, also does not hamper the endometrium, and therefore is a gold standard now and is being chosen as the first line of treatment to bring about ovulation in case of PCOS. The live birth rate and the pregnancy rate with the letrozole is much higher than compared to clomiphene citrate in most of the clinical studies. So, I would advocate letrozole as the first line of treatment for treatment of PCOS. If the patient has not ovulated or not responded to oral line of medication, then we will go ahead with injectables. The injectable line of treatment that we choose first is injectable FSH, that is follicle stimulating hormone. Follicle stimulating hormone can be started from as low as 37.5 international units per day and it can be gradually increased to up to 225 international units per day. What we do is we usually start the patient with 37.5, we give it for 7 days, see the follicular development on ultrasound. If the follicles have even grown up to a size of 8 to 10 millimeters, that is called as good follicular response, or the follicles are responding to the dose of FSH, and we will gradually step it up to 75, 100, 125, 150, 175 and 225. What we want to achieve is around development of 2 to 3 follicles of 18 to 20 millimeter size. When that is achieved, we give a trigger with injection HCG, which can be in the form of 10,000 international units, or if there is multifollicular development, that is we have more than 3 to 4 follicles of 18 to 20 millimeter size, then what we do is we give Lupride in the dose of 0.1 milligram subcutaneously and bring about rupture of those follicles. And when these follicles have ruptured and we have confirmed it on ultrasound, we advise the patient to undergo planned relations on that day, or we can go ahead with intrauterine insemination, that is IUI. Intrauterine insemination is a technique in which we directly inject the sperms, the husband's sperm, or if the husband is azoospermic, then we take proper consent into a donor IUI and put the sperms directly into the intrauterine cavity. So that also increases the pregnancy rate to around 20%. So what we are generally dealing with to treat PCOS is bring about proper ovulation, correct the diet of the patient, change the lifestyle, bring about weight reduction, bring about ovulation, and treat the disorder in a comprehensive manner. Also, what we would like to do in PCOS is change the mindset, decrease the negativity, bring about more positivity in the patient, counsel the couple, decrease the stress in their life, and bring about more comprehensiveness and harmony in the patient, which will increase the pregnancy rate. Just treating the disease is not enough. What we need to do is bring about proper mentality in the patient. Counseling forms a very important part of PCOS, because bringing about weight reduction is not a very easy thing. If you tell the patient that she has to get up and walk for 3 kilometers per day, she will not do it from day one itself. This has to be done on a gradual basis. This needs proper support and proper counseling. She has to be convinced that it is her weight reduction that is going to bring about changes in the hormones in her body, and only then will she ovulate properly, and only then will she be able to conceive. So counseling forms a major part in the treatment of PCOS. Along with that, the oral drugs that we have mentioned, that is, which is a combination of folic acid, myoinositol, dechiroinositol, having bromine in it, lycopene, folic acid, chromium. All these antioxidants also play a major role, and they are empirically used in the treatment of PCOS. If the patient is not responding to all this, then we finally give injectable, and if the patient does not even respond to that, or if she is going into OHSS, that is ovarian hyperactive syndrome, that is we are having more than 3 or 4 follicular development, and we have a risk of very high estradiol levels, and if we have a life-threatening situation, then we shift the patient from the IUI cycle to an IVF cycle, or we go ahead with retrieving all the developed eggs and we ovulate them, we inject the sperms in it and form the embryos or blastocyst outside in a lab, and then put the embryos inside the uterine cavity and bring about a pregnancy. So the last step of treatment of PCOS is bringing about IVF, ICSI, or test tube baby, that is called in lay language. So that is the last treatment for PCOS. So but the first line of treatment is lifestyle modification, weight reduction, oral drugs, and then injectables, doing the IUI, and if the patient does not respond to them, the last step of treatment is doing the IVF ICSI. So what I would like to send across a message to all the patients is believe in healthy lifestyle, keep a positive mentality, leave away the stress, and be in harmony with your partner. So that will bring about a positive attitude, and pregnancy can happen within no time. Also, the message to all doctors is that Since we are seeing a rise in PCOS, counsel the patients repeatedly that avoid junk food, bring about weight reduction, and reach to the doctor in proper time before it is too late to achieve a pregnancy. Thank you so much.